Hey everyone, it's Dr. Agatha Bis, just doing a quick video on tips and tricks with Kera, and she's gonna lead you through a bunch of little things that we learned to make scanning super easy and fast and efficient and quick.
Yay!
So Kera,
Yeah.
where do you start on the lower? Because you start on the lower, obviously. The scanner tells you where to start, but how do you, what initiates the scan?
So when you start scanning the occlusal, that's where it likes to pick up. So you do all of the occlusal, and then you start going off to the buccal, to the midline, and then you switch to the other side and go to the midline, and then you do a nice big swoop on the inside, and it brings everything together.
Do you start on the right or the left side?
I don't know, whatever I feel like that day.
What do you do?
I think usually
I always start on the right.
I think I usually start on the left.
You do?
Yeah.
I always start on
Just
the
like
right.
reach across and come this way.
Oh, okay.
Yeah. And it's very important to keep the teeth really dry because it doesn't pick up well with saliva, so I always wipe off the teeth with gauze first. And you just have to instruct the patient to stay open the whole time just because you want to keep it really, really dry. And then when you're coming to the front, it's always best to retract the lower lip as you're going so you can like slowly rock across the incisal. Otherwise it creates voids in the skin and it doesn't bring them together. Coming around to the midline, you want to lay it flat so it gets all like the inner proximal. Then you go back to the other side, let it pick up on the occlusal. They're easy to scan.
Yeah.
Not every patient's like this.
I think it just has to do with the anatomy,
Yeah.
and then also if they're compliant too. If they stay
when
open.
the tongue's not in the way, saliva.
Yeah, there's some people that produce too much saliva, or just a lot of it. And do you find you're using your elbows a lot when you scan?
I think so.
Talk about the patients that are a challenge. Like, what are some of the challenges?
They don't want to swallow. So their saliva pools up and then it gets into the camera and it won't pick up anything.
So how do you manage that?
I always just tell them to swallow. If I have help suctioning.
Sometimes the patient doesn't want to swallow because they're like, oh.
Yeah.
So do you pause the scan and then start over, or
Yeah.
do you just pull out, let them swallow or suction, and then go back in and just keep going?
Yeah, I just keep going because I don't want to delete everything unless I really have to, and I'm getting like a ton of images because they're like super difficult. But yeah.
Another challenge you can talk about is when they have large interproximal spaces, like it's so hard like scanning, getting the right angulation when there's like a giant gap of just a dentulous space.
Yeah, so how do you guys get around that?
Like you literally have to go in different corners of the mouth, like just try, you'll be on the opposite arch sometimes just trying to get it. Like, cause it's so like awkward to get that like one contact, like the mesial and distal.
Okay, so let's just review what you did on me on here.
Okay.
And then kind of go over what Kelly said. So, okay. Is this a good place to rest it? Okay, so what do you do?
So I start on the occlusal and I go
Don't
here.
touch it. Titties, ew.
I just go across the occlusal and then I start rocking across the anterior and then I back it up. Go
Back it up.
And then I go along the buccal like this. And then you have to kind of, I'll show you. Okay. Buccal and then you like lay it flat like that. So it's like perpendicular, I guess. If that's the right word. And then same thing on the other side. And then when you're doing the buccal, you want to kind of like hug the distal of the tooth and like rotate with your wrist. And then just go around like that and then hug across over there.
So one thing I notice you guys do really well that like new people don't is a lot of people come from the side, right? Or did you guys come from the front? So when you come from the side on a mono,
Yeah.
it's easy, but in a patient coming from the side, everything gets in the way and you're pulling your face and cheek and everything and it gets awkward.
Yeah.
So
you want to come from the front.
You always
like
want to come from the front, and you want to like really angle. Okay, so you want to come from the front,
yeah,
and then you want to angle. Use the handle, so show that too, because a lot of people get wimpy about raising it.
Yeah.
So you want to do that
like
movement
that and get them to open as wide as they can, and then you'll be able to get in there.
Yeah. So what I find is a lot of people when we're showing somebody new, they even if they come in directly in, they kind of try and like get the image like this, and they're like all weird and wimpy. Whereas if you move the base, like this part of the handle, and use that, you get a much better image really quickly. So, okay. And what was the thing you were saying, Kelly?
The interproximal spaces.
Oh yeah, so let's say that there's a missing space here, right? So how would you get around that?
So again, come from the front, and I go like this and raise it up so I can try and get the distal, and then I'll like bring it down as far as I can, or I'll like rotate it kind of sideways like this.
Yeah.
To get in there, or I'll come from like the buccal or lingual and like really hug the tooth like this.
Nice.
So getting the existing teeth first, and then connecting them with the missing space. Okay.
Yeah.
Yeah. You could also talk about how sometimes you get the patient to close down, like to get the distal of like, like the back of the molar.
Yeah.
Oh, so in here, so show that and then you can show it.
So on the top, I get them to close halfway because usually their cheeks in the way, so that I can like slide it in here and get the distal of the molar like that.
Yeah. Okay, so you're using, again, the handle to like control it. Yeah. You want to just show that on the side, though?
Yeah.
It's easier on the camera.
So here, I'll get you to close about halfway. See how I can get the distal really easy when they're like closed.
Good job, Kira.
I can open again. Again, just pulling the lip as you go. It's just easier because then you don't want the lip to be in the images.
That's right.
That's right. Here we close again about halfway so that I can go like that and get that little missing piece. And then same, you're going to lay it flat across the interior. Same with the lingual, you're just rotating the handle just like this.
What I find too sometimes is when people are scanning, when they're scanning a patient, they keep their elbows in and they don't have a lot of control, so they really struggle with the handle. Whereas if you raise your elbows when you're scanning, you're actually using your arm to control the scanner as opposed to your wrist. So using your wrist puts your hand at risk for like carpal tunnel and muscle tension and stuff. If you raise your elbows, then you're using your whole arm, so your hand stays straight, right? Your wrist stays straight, and it's like your elbow that does the work. So it takes away the pressure that we all kind of feel in our hands when we're working. Right? Okay. So like kind of show the difference between squished and like that.
Okay. So this is squished. Here you have a lot more like room to move around and get more images and stuff.
Yeah, and you're not weird with your wrist like this.
Yeah.
Like a T-Rex.
Why do we trim?
it takes away any like excess for when we're printing models or anything like that. So it's really nice and clean.
Saves a ton of time
Saves a lot
loading
of
the
time.
images.
Yeah. The challenge of mounting
Makes
them.
them just look really pretty too.
Yes.
Yeah.
You said it. That's my big thing.
Instead of having like tissue flip.
Like I feel like it's like an OCD thing. It's like I can't click the next like step until it like looks like clean.
Oh yeah, with the bite, a lot of patients, when you ask them to bite down, they'll bite down one way, but then when you're scanning, they shift the bite, and then what happens is the restorations become sometimes that you have to adjust because you're building them out in a different position than the actual bite. So the trick to getting the right bite, and something we do a lot, is first of all, kind of looking at where the patient bites down and reproducing it, but second, making sure the patient knows to stay biting in one spot and not shift around, because like if they're shifting around, they don't even realize it, but if you tell them, then they'll kind of focus on staying and not moving their mandible. And sometimes what we'll do is we'll support the mandible when we're scanning the bite, just so even more so keep them in one place, so that you don't open it up and then end up having occlusal issues and then having to do a bunch of adjustments. So yeah, let's do that. I could even like show you like the two different, like when people bite and then the shift and then where they bite normally. So we'll show both where the bite comes together and when the bite comes struggling.
Okay. So again, you want to dry the teeth because the saliva won't click the teeth together. So I always tell the patient I'm going to pull their cheek out of the way and then have them bite down on their back teeth. So go ahead and bite down, and then I always tell them to hold just like that. And you want to slowly move forward so that it can pick up.
You can kind of see how she opened there.
I didn't know that she was doing that. So
Yeah, I'm totally doing what the patients do, and it drives you crazy. But all they do is tiny little shifts. But the reason things are not coming together right away is because they're moving. So don't waste your time and just practice the bite, get them to bite down, and then hold. I'll even like say hold, right?
Yeah.
So they're focused on that. One of the things that I don't know if you're doing when I'm having trouble getting a bite, what I'll do is I'll actually scan the tissue more first, but instead of focusing on the teeth, do a quick sweep of the upper tissue and a quick sweep of the lower tissue and see.
That's so
Yeah.
nice.
Any other tips?
Sometimes if their frenum is like really high, like, and you can't get enough tissue, I'll literally just ask them to help me retract their lip. That's something I can think of that I do.
Oh, that's a good idea.
If I don't have any help from like an assistant, like I'll just be like, you know, I can't get the tissue. So I'll ask them to try and relax their lip, because there are some people that have like the pusher lip.
The pusher lip.
The pusher lip that we call it. So where they can't relax it. So you can just ask them to pull it down, because ultimately you have to get the tissue. Yeah. And then like if they produce a lot of saliva, suctioning, getting help from an assistant for that, because some people produce a lot. Oh yeah, and then like trimming is also really important for when you are trying to mount models on the what's that thing called again? The
virtual articulator, the software.
Yeah, the software.
It's a virtual articulator.
The virtual articulator, because then like it won't mount sometimes with excess tissue sticking out. So that's all I can think
you're talking about the model, the printer.
Yeah.
To throw the models into it's the virtual printer.
Oh, right.
So yeah, when you import them, they take forever to import, right? When they have all this stuff coming off it, whereas when they're nicely trimmed, they just drop right in. If there is a challenging patient, or you're just learning, or you're having a hard time scanning and you're doing a lot, one of the things I recommend is that you kind of go like really fast with this thing. So you go get all the occlusals really quickly, and then give it a sec to load, and then come back and pick up again, and just do quick swoops first, as opposed to spending a lot of time trying to get one spot. and then just go back and touch up the spots that you missed. So instead of kind of like spending a lot of time and getting a ton of images in one area, right? Just because then you're like loading up this thing with a zillion images where you could probably get a lot of it with just a quick swoop and then just go back into the one area that you need, especially if it's like a restorative case where you need only 1 or 2 areas that have to be super clear, whereas the rest of it you can have a couple of missing spots, right?